and welcome. My name is Judy, and this is my information speech. It is on the cause and effects of a craniopharyngioma, which is a brain tumor. I have a 10-year-old son. His name's Justin. He has a craniopharyngioma, which is a brain tumor. Craniopharyngioma is made up of 3 words. Cranio is skull, pharyn is throat, and oma is tumor. He was diagnosed at 3 years old with this brain tumor. The reason I'm giving this speech is because I've dealt with it since I've been in the family, which is 5 years. So I feel like I know what I'm talking about when I talk about it. In Justin's case, the doctor said that a throat cell did not migrate to his throat, and instead it stayed in the back of his skull in his pituitary gland. And what happened was, instead of this cell going where it should have, it stayed there and then it started growing. This brain tumor makes up 2 to 4% of all brain tumors. It is observed mostly in children from 2 to 5 years old. It rarely spreads, but it does cause many other problems. Once it starts growing, it can cut off the flow of your spinal fluid from your brain, and it can also cause a lot of brain swelling. It can, once it starts, it can cause optic pressure, and it can cause you to go blind or lose your sight pretty quickly. The most common signs and symptoms are headaches, visual problems, obesity, and endocrine issues. Endocrine means what it is it's part of your body. It's your glands that are in your body, and it controls a lot of your function. It controls body temperature, it controls your mood, your growth, tissue function, metabolism, quite a few functions. It also controls your kidneys, how they have output from drinking. In Justin's case, the tumor started small, but has been increasing in size. And when he was 3 years old, he had brain surgery to remove the tumor. This did not work because they couldn't fully remove that tumor, because it was like a big wad of chewing gum wrapped around part of his brain stem and his pituitary gland. So since that did not work, the next step was to do radiation therapy. The radiation therapy was called a P32, and that was a injection of radiation straight into that part of his brain where that tumor was located. And that worked for a while, and the tumor didn't grow. But then once again it started growing again. So then our next option was called proton beam radiation therapy. And this was a 16-week therapy. It was done at a place near Indiana University in Bloomington, Indiana. It is more concentrated, and it goes right where the tumor is located. It doesn't actually cover the whole side of the brain like the other one did. It's more focused. After a year of him having this radiation therapy, things seemed to look pretty good, but the bad part was that he lost all of his pituitary function, which has been his biggest problem since the therapy. What happened with Justin was his body cannot hold on to the water. So when he drinks, he wants to urinate, and then he becomes very dehydrated because he cannot control or stop the urination. He will just completely drain himself. And this condition is called diabetes insipidus, which is not like the diabetes that you and I have heard a lot of about controlling sugar, but it's more or less could be called water diabetes, which is what it is, controlling your water in your body. So our biggest problem there was keeping his medicines regulated. In April of 2007, Justin had a shunt malfunction. A shunt was placed when his first surgery was done into his brain, and it was a tube that ran down to his abdomen to keep his brain pressure reduced. and to keep his fluids draining as they should. He had he had a shunt malfunction in 2007, so we took him to Riley Hospital in Indianapolis, and they had to do emergency surgery to correct his problem, and Justin suffered a right side stroke because he was so dehydrated from this diabetes insipidus. Justin currently now is in a wheelchair. He has no left side function, very limited if any, and he's currently mentally and physically impaired. The tumor continues to wreak havoc on Justin. It's not grown since he's had his radiation therapy in Bloomington, but it is very difficult for him now that he's in a wheelchair. The doctors say this condition's not going to improve. We just have to keep monitoring him and doing the best that we can. In most tumors, the tumor itself can be controlled, it can be removed, and things are pretty much normal for the patient. But with Justin, we weren't that lucky. Things went terribly wrong. This tumor has had tremendous effects on Justin in so many different ways. And it's just a monster, and I really wish I could change things for Justin. I have a few pictures of Justin. This first picture was in 2006. He was playing t-ball with his cousin Noah. He was in pretty good shape. He had a little left side problem, but nothing major. This was in Florida in 2007. He was still able to walk, and he was on the beach having a good time. This next one is after his proton beam radiation therapy that he had. He still looks pretty healthy. And then this is Justin in 2009, as it's getting a little worse. And then this is Justin today. He's completely wheelchair bound. This tumor is such a monster, and I wish somehow, some way, we could find a way to control it, stop it, and fix all of his other side effects. That would just be a wonderful miracle. The works that I've cited in my speech, there was a article from Michael Scott and Edward Smith from the Children's Hospital of Boston, from the Department of Neurosurgery. It was called "My Child Has a Craniopharyngioma," and that was in the Health Journal in 2009. There was also Ann Ehrlich and Carol Schroeder from 2005, Medical Terminology for Health Professionals. I also cited George C. Bostach from the Department of Neuro-Oncology, the Anderson Cancer Center. His article is called "Craniopharyngioma." And there was a couple of websites I also used. Thank you.